Hello everyone, our topic for today is very important. It's a joint pain. So this is my approach for this joint pain. So there are general questions that fits with every joint pain, and there are specific questions that fits for certain joint pain. For example, neck pain, back pain have different questions from a knee pain. Okay? So this is how we're going to talk about that. So what I'm talking about is after you ask the onset, frequency, aggravating, relieving factor, medical history, family history, social history, okay, all of these things, and then that's what I'm going to talk about right now. After those you go to the different types of pain. Okay, so if there is any pain, this is the mnemonic that I use: WRSSWNT. The first one is that if there's any warmth, okay, redness, swelling, this is signs of infection. The last S is for stiffness, could be with autoimmune disease. And then the WNT is with the neurological: weakness, numbness, tingling. WNT. Okay, so these are the general questions. Okay, you ask any warmth, redness, stiffness, swelling, weakness, numbness, and tingling. Okay, so this is the general. After that, it depends on where is the joint pain. Okay, where is it? Now, if it is neck pain or back pain, they have similar questions. So this is what we ask about, because they go through their neck pain, back pain is that's where the spinal cord. So it's not just musculoskeletal. We got to think about neurological symptoms. So any changes in your gait, that's the one. Have you been lifting any heavy weight recently? Okay, this is important. It could be to muscular spasm after lifting weight. Any urine leakage, okay, any incompetence, okay. Okay, this is for because the neurological, again, any effect on position on pain, any effect of position on pain, okay, because spinal stenosis, this is usually worse cartwheel sign, better when they push the cartwheel. Okay, any trouble breathing, okay, this is important too, neurological. Any trouble with light or light, this is for neck only, because there's this just to rule out meningitis, because they have photosensitivity and neck stiffness, neck pain. Okay, so this is the differentials for neck pain: osteoarthritis, disc herniation, fracture, cervical spondylosis. If there is weakness, numbness, tingling. If there is no weakness, numbness, tingling, then the differentials will be different. For example, muscle strain, metastatic cancer, multiple myeloma, meningitis, and rheumatoid arthritis. Okay, so this is important. Now for back pain, okay, back pain, same thing. Like if there is similar, if there is weakness, numbness, tingling, then we think of osteoarthritis, disc herniation, fracture, spondylosis. If there is no weakness, numbness, tingling, then it could be muscle strain, metastatic cancer, multiple myeloma, meningitis, SLE, rheumatoid arthritis. Okay, questions are kind of similar. Changes in your gait, heavy weight recently, trouble with urine or bowel movement, like leakage in urine or bowel, changes in position to pain. Okay, 4 things for neck and back pain. Okay, so now we are done with the neck and back pain. Okay, first you ask weakness, numbness, tingling. Okay, then different differentials based on that, and then 4 questions: gait, heavy weight, autonomic activity, I call it, urine and bowel leakage, and position and changes in effect on position because of the spinal stenosis. That's right. Okay, now for hip pain, let's go a little bit down. So the hip pain, what could be causing the hip pain? The differential diagnosis could be bursitis, referred pain, arterial insufficiency, steroid abuse, muscle strain, septic arthritis, osteoarthritis, and fractures. Okay, so these are the things that causes hip pain. So let's see, bursitis, this is very important. First, you see the hip pain is important. Is it anterior hip? Is it lateral hip? Is it posterior? Okay, so if it's anterior, this is most likely osteoarthritis. If it's lateral, that's trochanteric bursitis. Okay, If it's posterior, then it could be muscle, piriformis muscle. This is the first thing that we gotta take care of. And then for bursitis, you ask, because it's a lateral, as I said, you ask any pain where you lie on the side. Okay, do you have any pain when you lie on that side? For fracture, you have any trauma recently, any vigorous exercise. This is for fracture. Could be even stress fracture, but it's very rare to happen there. Osteoarthritis, any stiffness of joints, okay? Any scratching sensations in your joints too. Stiffness, scratching sensation is for osteoarthritis. Arterial insufficiency, you ask him two things. Problem maintaining an erection associated with that. Any improvement of the pain if you rest after walking from a distance, okay? This, you think of that too, because the big arteries run through the hip. Referred pain, you have any pain anywhere else, okay? It could be referred to the hip. Osteoporosis, you ask about menstrual history, check their age status, okay? Out. They're taking hormone replacement therapy too. This is important. For sprain, have you noticed any heavy weight recently? Have you had any heavy weight? For steroid and drugs, we also ask about drugs. So this is, we can ask about medications, because steroid and drugs could cause avascular necrosis in the femoral head and cause you to have hip pain. Knee pain. So for knee pain, what do we ask about? We ask any discoloration of your fingers to cold temperatures, okay? Because knee pain could be associated with Raynaud phenomenon, okay? It could be we ask any hair loss, okay? We ask any pain in other joint, okay? Does the knee pain worse when exposed to light? For what? For systemic lupus erythematosus. Any popping sound from the knee. This is for meniscal injury, okay? This is important. Let's see, okay. Any fatigue, okay? Fatigue for systemic lupus erythematosus, that's what we think for. Okay, so in summary, the knee pain differentials: osteoarthritis, gout, pseudogout, septic arthritis, gonococcal and non-gonococcal, SLE, and rheumatoid arthritis, okay? So this is for knee pain. Now we move on to the other type of joint pain. So for cough pain, this is what we think of DVT. This is very important thing. So the differential diagnosis, it could be DVT, Baker cyst, this is for the rheumatoid arthritis, hematoma after trauma, cellulitis, myositis, if there's infection, there's trauma too, or there is an immunodeficiency. Gastrocnemius tendon rupture, okay, could be that. Muscle strain too. So after trauma, okay. So what we ask about, we ask any visible veins or pulsations. This is just for DVT. Have you been immobilized recently? And are you taking any contraceptive pills, okay? And we ask any shortness of breath, chest pain, okay? Because this is very important. This is for pulmonary embolism, okay? So because this what could kill the patient right now, okay? So for cough pain, DVT, okay? So now we talked about neck pain, back pain. We think of what? Neurological spinal cord injury. For hip pain, we think of bursitis and arterial insufficiency. For knee pain, SLE, we think of that too, besides the musculoskeletal, of course. For cough pain, we think of DVT, okay, beside the musculoskeletal. Okay, now we left with heel pain and arm pain, okay. For heel pain, what do we think of differentials wise? It could be plantar fasciitis, it could be ankylosing spondylitis, it could be calcaneal stress fracture, it could be retrocalcaneal bursitis, it could be foreign body, it could be ankle sprain, and it could be tarsal tunnel syndrome. So the question that we ask about, what time does it hurt the most? Okay, so morning or evening, okay? Any difficulty walking, okay? What precipitates your pain? This we're gonna already ask about aggravating relieving factor. Any fracture, history of fracture, okay? Any stepped on pointed object or any popping sound, okay? That you heard, okay? So this is the the important stuff that we should consider is that ankle sprain. Okay, that's the common one. Now for arm pain is very important topic. This is very important because the differentials, it could be muscle strain, it could be angina, MI, it could be rotator cuff tear, it could be fracture, it could be abuse, elder abuse usually, shoulder dislocation, and tendonitis. Okay, so these are the things that we think of, very important, could be tricked very easily. Okay, so for arm pain in general, to rule out MI, you can ask the MI question: chest pain, shortness of breath, okay, sweating, racing heart. Okay, this is the thing. But there are something very important which is called elder abuse. Okay. So for elder abuse, what questions we ask about? There's some mnemonics called safeguard. S, do you feel safe at home? A, are you afraid of whoever you live with? Husband, son, whatever. Okay, safe. Okay. E, for emergency exit. Have you had any emergency exit? Okay. Guard. G, for gun at home. Is there any gun at home? Okay. Guard. A, for alcoholic. Is your son or husband alcoholic? Okay. Guard. R, how's your relationship, okay, to your others, whoever you live with? Safeguard. D, for depressed. Any suicidal ideation, depression. So all of these, any of these are signs of abuse. Okay. So S, safe at home. AF, afraid. E, escape. G, for gun. A, for alcohol. R, for how's your relationship with the other person. D, for depression. Okay, so these are the most important things. After that, we talked about everything. Then we go to the investigations. Could be CBC, CMP, ESR, erythrocentesis and analysis, X-ray, knee. If the knee, we can do AP and lateral view. We do CT scan of the knee, MRI of the knee, DEXA scan, calcium and vitamin D level. These are important. Okay, these are the labs that we order. But before that, physical exam. So physical exam, hint, and inspect. This is the thing. You look at the joint, palpate, the range of motion after that. Okay, 3 things, very important. And then you assess the motor reflexes, sensations, pulses. Okay, and assess the gait. It's very important. Compare to the other side. Always compare to the other side. Inspect here, palpate here, palpate. Range of motion, both. Okay, motor reflexes, both, same thing. Okay, so now in a quick recap, okay, for joint pain, how do we work this up? First, we do the ODPF, mnemonic and PAM-HITS-FOSS, the medical history and the pain history taking. After that, we ask general questions: WRSS, WNT, warmth, redness, swelling, stiffness, weakness, numbness, tingling. For neck pain and back pain, we think of the spinal cord. So we think about what? We think about autonomic instability, like urine, bowel incontinence. For hip pain, we think about bursitis and arterial insufficiency. So we ask about the side. This is very important. For knee pain, we think about SLE and meniscal tear. Okay. For calf pain, we think about DVT. This is very important, and Baker's cyst if they have rheumatoid arthritis. Heel pain, we think about fracture or like trauma, sprain. Okay. For arm pain, we think about elder abuse. This is very important, and heart attack. We think about that too. Okay, and this is the end of the joint pain and the history taking course. Thank you so much for listening. Please leave a feedback if there's anything that I can improve on. Okay, I see you in the next class.